forward to your identifying the priority research questions so that we can help shape the global research agenda in relation to the role of physical activity in infectious diseases such as COVID, and how to scale public health action to promote physical activity in COVID recovery plans, and more widely, our long-term global health agenda to successfully increase physical activity by 2030.
Studies suggest that doing regular moderate to vigorous exercise can improve immune function. It can reduce systemic inflammation, and certainly we know it benefits cardiovascular health, lung capacity, muscle strength, and mental health, among various other benefits.
This idea that exercise creates an anti-inflammatory environment and lower chronic inflammation can at least partly explain the findings by Bob Salis.
Those who were meeting the physical activity guidelines were about 70% less likely to be hospitalized and about 80% less likely to die from COVID.
So we found marked regional, socioeconomic, and ethnic inequality in COVID infections in Brazil. The North region much more affected than the other regions. Black people and indigenous population much more affected than the white population. And finally, the poorest populations more affected than the richest population.
Let's stop keeping physical activity a secret. I would like to see more priority given to physical activity in the medical field, in the public health field. The evidence is very strong. The response and action to that evidence is very weak in most places around the world. The source of push to policymakers really needs to come from the people.
The medical establishment is going to change physical activity levels across the country. We saw that with smoking. But it took a while before physicians actually started to ask patients, do you smoke? And we're just looking for the same things, the same sort of treatment of exercise. But I really think the solution is going to come, as Jim has outlined, that it's in the community.
Overall strategies is to make sure there are active places, that there are easy to access. So having sidewalks and footpaths, having safe places to bicycle are very important. The other aspect is places for people to go for recreation. So that would include parks. That would include trails.
The type of intervention to promote active transportation in low and middle income countries is somehow different to the type of intervention we need in high-income countries.
So I really think it should be a law saying that you are not allowed to create infrastructure and architecture that does not support physical activity. It's clear that regular physical activity has a lot of effects. But we need to understand the big black box. Why is it so efficient? We need to know what is happening within the cells, which signaling pathways are exercise activating. We need to know that in order to better be able to prescribe exercise as medicine for specific diseases.
One of the key research questions is, what is the role of physical activity in the treatment of long COVID?
There's a coming question, and that is, we don't know how long the vaccination effectiveness is going to last. Given the demonstrated immune effects of physical activity, I would like to see studies on physical activity effects on improving sustainability of vaccination.
We need to get low and middle income country governments to be engaged with physical activity so that there will be funding for it.
I would like to appoint every person on this webinar to advocate to their health ministries that we need to do more research on physical activity in every country.
I think it's a matter of scaling up and a matter of implementation, because the science and the biological plausibility is here. So we just need to make it happen in real world. And in order to do that, we need to have research on implementation and scaling up.
We started off with the science, and we heard about the existing evidence, and we had shared with us from Bob new evidence about the double duty role of physical activity, not only it directly affecting and improving individuals' health and prevention of those severe COVID outcomes, but also that it actually is, of course, critical to those underlying conditions that we hear of and can reduce and prevent those.